enlarged prostate, or benign prostatic hyperplasia, or benign prostatic hypertrophy, or BPH. Let's talk about this. So, as you can see on this diagram, the prostate is located just below the bladder and it aids in the production of semen. Additionally, during ejaculation, the prostate contracts to ensure semen is expelled outwards through the urethra instead of into the bladder. As men age, the prostate increases in size and it may end up causing symptoms such as obstructing the outflow of urine. Additionally, it can cause kidney, urinary tract, and bladder issues. In terms of treatment, there is lifestyle changes, medication, and surgeries. The course of treatment is determined by your symptoms, size of your prostate, and any other medical conditions that you may have. So, let's talk about the symptoms. Some of the common symptoms of BPH are a frequent and urgent need to pass urine. However, note that this may also be a sign of a urine infection, which can occur even if you don't have BPH. Another one is passing urine more frequently at night. This symptom is also known as nocturia, but note that this is also a symptom of poorly controlled diabetes. Also, you may find it difficult to start urination, and when you do, the stream is weak or has a start and stop pattern. At the end of urination, there may be dribbling. Also, you may get the sensation that the bladder is not fully empty and you may need to go again a few moments later. Blood in the urine is also a possible symptom, and this is called hematuria. Now, hematuria is also possible in a bladder infection, but more seriously, kidney cancer. Now, note that the size of the prostate does not determine the severity of the symptoms. Now, with some, the symptoms may get worse with time. With others, it may reach a point and then stabilize. And with other men, the symptoms may actually improve over time. Now, of course, there are other medical conditions that can have symptoms similar to that of BPH. Some of these conditions are a urinary tract infection, or what is loosely called a urine infection, also an inflamed prostate, also known as prostatitis, bladder or kidney stones, a narrowing of the urethra, scarring of the bladder neck due to a past surgical procedure, issues with nerves that control the bladder, and cancer of the bladder or prostate. Additionally, there are medications that can cause symptoms similar to that of BPH. Some of these medications are opioids, powerful class of pain medications, certain cold and allergy medications, and also a class of antidepressants known as tricyclic antidepressants. Why is the flow of urine affected in BPH? Now, as you can see on this diagram, the urethra, which is the tube that runs from the bladder into the penis, has to pass through the prostate. As you can appreciate, if the prostate gets larger, it will begin to constrict the urethra, and hence the flow of urine will be hindered. Throughout your life, the prostate gland will keep increasing in size, and this is possibly due to sex hormone changes. Now, let's talk about the risk factors for BPH or an enlarged prostate. Age. Now, it is not typical for an enlarged prostate to cause problems before age 40. However, beyond the age 40, the chances of having problems start to rise. Family history. As with many medical conditions, having a blood relative with prostate issues increases your chances of also having prostate issues. Diabetes and heart disease also increase your chances of BPH. And of course, obesity, carrying excess weight, increases your chances of an enlarged prostate. Now, we will discuss the complications of an enlarged prostate, or what it can lead to. Not being able to pass urine. This is also known as urinary retention. This is an emergency and you may need to have a catheter inserted to empty the bladder. If a catheter cannot be inserted due to a stricture in the urethra, a minor surgical procedure will need to be done to insert a catheter through the abdomen. An enlarged prostate can also lead to urinary tract infections. When you are unable to properly empty your bladder, the residual urine serves as a breeding ground for bacteria, so your risk of infection is increased. Bladder stone. When you cannot fully empty the bladder, minerals sediment and form stones over time. The bladder can become irritated, the flow of urine can become blocked, and you can even get blood in the urine. Kidney injury. When you are unable to pass urine, there can be a backflow of urine from the bladder all the way up to the kidneys, causing kidney injury. Now, we come to the diagnosis of BPH. So, as with many medical conditions, we start with the medical history, where you describe the history and nature of your symptoms. Also, you will need to tell your doctor about any pre-existing medical conditions that you have, as well as the treatments you are undergoing for them. Where the physical exam is concerned, there is the typical digital rectal exam, where a finger is inserted into the rectum to check the size of the prostate and determine if there is any asymmetric enlargement. Alternatively, a prostate ultrasound can be done via the abdomen to determine its size and shape. A urine test is also done to determine if you have a condition other than BPH that may be causing your symptoms. symptoms. And a kidney blood test is also done to rule out any kidney issue. Another blood test that is done is the PSA blood test. PSA stands for prostate-specific antigen, and this is produced by the prostate. And as the prostate enlarges, it would produce greater levels of PSA. There are other types of urine tests that determine the strength of the urine flow, what volume you pass, and whether or not you can fully empty your bladder. There is also an investigation called the cystoscopy. This is where a thin, flexible camera is threaded into the urethra to visualize the urethra and bladder. A lidocaine gel is used to numb the urethra before the camera is inserted. So, how is an enlarged prostate treated? Of course, it depends on the size of the prostate, severity of the symptoms, your age, and any pre-existing medical conditions. Now, if your symptoms don't affect the quality of your life, you may choose to delay treatment and see if the symptoms self-resolve. In terms of medication, some of them work by relaxing the muscles of the bladder, neck, and prostate, and of course, this makes passing urine easier. However, side effects may include dizziness and retrograde ejaculation. This is where semen flows into the bladder during orgasm. However, this is a harmless condition. Other types of medication cause shrinkage of the prostate by preventing certain hormonal changes. It may take a few months for these meds to work, and there may be some sexual side effects. So now let's discuss surgery for BPH. Surgery is an option if you don't get any relief from medications, you are unable to pass urine, if you have kidney issues, or you keep getting bladder stones, blood in the urine, or urinary tract infections. Of course, not everyone is a candidate for surgery, and you may not be a candidate for surgery in such cases as an untreated urinary tract infection. Any urinary tract infection will need to be dealt with before any surgery takes place. A stricture of the urethra that may prevent the passing of any surgical instrument, and neurological conditions such as Parkinson's disease or multiple sclerosis. No surgical procedure is without its side effects, and some of the side effects you can experience are retrograde ejaculation or semen flowing into the bladder during orgasm. Also, accidental leakage of urine, urinary tract infections, bleeding, and erectile dysfunction. So of course, a typical question is, what lifestyle changes can I make to deal with an enlarged prostate? You can reduce your water intake at night. Don't drink anything for about 2 hours before bedtime. This will help reduce the urge to pass urine. Reduce or eliminate caffeine and alcohol. Caffeine and alcohol can increase urine production and irritate your bladder. Engage in regular exercise, as this can reduce urinary problems due to an enlarged prostate. And if you are overweight, get down to a healthy weight. As soon as you feel the urge to pass urine, once it is practical, go ahead and pass urine. Delaying this for too long can cause stretching and injury of the bladder muscles. Also, have planned bathroom breaks. Have regular times where you pass urine. Practice double voiding. This is where you pass urine a few moments after the first time. Limit the use of decongestants and antihistamines, as this can cause the muscles around the urethra to tighten, making passing urine more difficult. Also, if practical, try to stay in a warmer rather than a colder temperature to reduce the production of urine. So that concludes our brief overview on BPH. If you would like to book to see our urologist, you can call our WhatsApp 747-5297-308-3370. We are located at number 4 Chincuna Gardens in Chinchin Road, Cunupia.
You can tap the description below for all of our contact information.